Hi friends, welcome to Charcos. I'm Dr. Seema Balian, the founder and director of Charcos. Charcos is a healthcare recruitment and training company with over 15 years of experience in providing turnkey solution for training and recruitment needs for the nurses, doctors, and AHPs such as radiographers, occupational therapists, ODPs, and many more. OSCE training for all fields of nursing such as adult nursing, mental health nursing, pediatric nurses, midwifery, and learning disabilities. OSCE training is available in India as well as in UK. Orientation for life in UK, OSCE exam bookings and the logistics bookings, excellent pastoral care. Our state-of-the-art learning platform includes reading materials, videos, quiz to enhance your learning and equip you for a positive and a better outcome. For more information, please visit our website www.charcosglobal.com. Our Facebook page, Instagram, and LinkedIn pages by the name of Charcos Global, and subscribe our YouTube channel. Press the bell icon for regular updates and all the information that you require. We are looking forward to seeing you on our site and being a partner in your enhanced journey. Thank you very much.
Midwifery OSCE evaluation. This is the last station of the APIE section. This station you will require to give a handover using the SPAR technique. Please be very methodical and thorough in giving the handover. Make sure you have given all the important information in the handover. You will be getting 8 minutes to complete this station. Okay, can you see my screen? Can you see my screen?
No.
Yes,
Yeah.
midwifery and
Evaluation.
MCOC. Yeah, evaluation.
Okay, so evaluation is our last station of the APIE. So we have done the assessment, we've done the care plan, we have done the implementation, and we have done we are now doing the evaluation. So what do we mean by evaluation? What are we actually doing in the evaluation station? Priscilla, tell me, what are we doing in the evaluation station?
That station, in terms of like judging whatever you've done, like, whatever care you've done so far, putting them together, then you hand it over.
Yes, a handover. So basically we have, now what we have done is that we have done the assessment of the patient, we have made a care plan of that patient, we have given the medication to the patient. Now it is the time for either the handover of the patient or in some cases the discharge of the patient. So that is basically what evaluation is. Yeah. So what we are, so as to complete like the journey of the patient when we are seeing any of the patient. So the evaluation is also, it is basically the station which has two aspects to it. So it's actually in the exam, you will need to give a verbal handover. So it is actually a verbal station. You are going to get 8 minutes for that one, but you will also be given a pen and a paper and all of your records. So you will be given all your, the history of the patient which you got in the assessment. Your meows chart also, they will give it to you, or the partogram, whatever you have completed. They will give you your care plan and the implementation. All of your documents will be given to you in this chart, or sorry, in this station. And you will have to then write down your evaluation. But the written part is only for yourself, to give you that so that you have a chance to make the notes that with which you will be giving a verbal handover. Yeah, the examiner is only going to be marking you on the verbal handover that you give. They are not going to be looking at what you have written or what notes you have made. They're not going to be checking that one. Okay, Now, I am sure that even in your life, like now, and also back home, you know that when we give a handover, so normally we do is that we will write like in a short form, we will write on a small page or some paper or somewhere that, okay, when we are sitting for the handover, one by one, we are going to tell that, okay, on patient in room number 1 is so and so, this is all that is. But you don't write the full detailed history of everyone. You just make small notes of them so that you can just read the notes and you can just quickly tell the story behind that one. Have you done that one, or is this how you do in the handover?
We summarize the history and we hand everything over.
Yeah, so that is exactly what you will need to do anyway, because you have just gone through the assessment care plan implementation. You will already know all those things, but since it is an exam and under the exam pressure, it is possible that you might forget something. That is the reason that it is always advisable to make few notes. And once you have made the notes, then you can just read it out from your notes and give a verbal handover to the examiner. Now, but you will get 8 minutes in the whole. So it is always recommended that you take around maximum 4 minutes, but ideally around 3.5 minutes to write down whatever you have to write. And in the next 4 to 4.5 minutes, you give out that verbal handover. Now, the handover that you will need to give is again going to be in an S-bar manner. The similar way as you would have written your care plan, in the similar fashion, you will need to give your handover as well. Have you understood? Yeah, I can see it's getting a little bit too much, huh? You guys are getting tired. Yeah, don't worry. I think that it is going to take another 10 minutes and then we'll finish this one.
Okay.
Yeah, so this one does not have too much on evaluation because we have already gone through that how we have to do like what does the S bar mean. We have also gone through that what exactly the situation, background, assessment recommendation, how you are going to be writing those things. And in these ones, when you are doing the evaluation, again, exactly same way you have to write, you have to describe the situation in saying that, okay, I'm Priscilla, I'm one of the midwife who is working over here in this ward. So I'm going to be giving a handover of my patient called so-and-so with date of birth so-and-so and the hospital number so-and-so. The patient was admitted in the morning because of the abdominal or because of the mild PV bleed, which she had after having a sexual intercourse at 7:30 in the morning, and the bleeding started at 8:30. That becomes your situation. Your background, you can say that the patient is gravida 2 para 1. She is 34 weeks pregnant now. There is no other history of any problem throughout this pregnancy. It has been quite uneventful pregnancy, and she have had her 2 scans, and the scans have been fine. The patient is in the past, she has already have one live baby. She has been pregnant 3 years back. She had a normal delivery at that time, and there was no problem throughout the pregnancy or after the pregnancy as well. The baby is doing fine. There was no, it was an uneventful delivery. There is no significant medical history. A patient is not on any regular medication. She is not allergic to anything. The family history is she lives with her husband and her child, who is now 3 years old. She has got good support from her husband, and she is currently not working, but and she is planning to not go to work for another year after the delivery as well. So this becomes like your background. In the assessment, you can say that when the patient came in this morning, she was assessed, and at that time, this was the assessment at the time of admission. But after that, since this is an evaluation, so you would have already have done some more assessments of the patient as well. Yeah, so you will give the most recent assessment in your assessment, sort of in the A part of the assessment. and that will be given to you as your as the question paper, that her most recent assessment is this. So you can read out that her most recent assessment is that she have not had any further bleeding since morning, since the last 3 hours. She had the pain in her, she's not complaining of any more pain in her abdomen. Her temperature, blood pressure, pulse is all good. You can read them out that her temperature is 36.5, her blood pressure is so and so, and her pulse is so and so. The abdomen is soft, the fetal movements are there, the fetal heart rate is so and it is a cephalic presentation, not engaged head. And patient is passing urine all right. Last urine was no proteins, no ketones in the urine. She's eating and drinking fine. So this is your current assessment. Then you give your recommendations that as per my recommendation, patient is to be kept under observation overnight. She will need to have a review from the medics tomorrow morning or SOS if anything changes. The observations currently are 1 hourly, which we are going to continue as 1 hourly observations using the meows chart. If anything changes, the fetal heart rate and thing will need to be done every hourly. If there is any changes which happens, either further bleeding or any pain, contractions, then they need to be notified. If the blood tests were sent, then you can say that we need to get the results back and act accordingly. Yeah. So these are kind of like the recommendations that you can give. Okay. So this is basically how you are going to be doing an evaluation and giving that verbal handover.
Okay.
So common mistakes in this one are most of the time it is incomplete handover that maybe you
Kasim,
forgot.
I'm not seeing anything on my screen. Oh. Is
Sorry,
it my
say again?
phone? My screen is blank.
Priscilla, can you see it? Oh, sorry, Mercy, can you see it? Or you can't, you can also not see my screen.
She's on mute. I don't know.
Mercy, if you are on mute, then please unmute yourself.
Please. Oh, sorry. I can see it.
You
Okay,
can't
then
see or
it's
you
from
can
my
see?
end.
Yeah, I can see from my end. It's visible. I can see it.
Oh.
Okay, doesn't matter, Priscilla. Anyway, I'm recording it, so I will be sharing it with you, but there is nothing specific that you have missed. I have only just written these common mistakes. So I can tell you that the common mistakes usually are that if you give an incomplete handover, for example, if you forget to tell about the allergies or if you forget to tell about the current assessment, if you miss the patient introduction or the reason why you are giving a handover, or if you miss any of the other vital sort of thing like your muse, the meows chart or a PHQ-9 or something else which is there, if you do not acknowledge what the patient condition is, or if you are your communication is unclear, or if you are giving a very unsystematic or unstructured approach, like you are jumping from one place to another. Yeah. So it's always a good idea to say it that, okay, my situation is, and you tell about the situation. Then you tell that the background of my patient is, and you give the background of the patient. Then you say the current assessment of my patient is, and you give the assessment. And then you say that my recommendations are, and you give your recommendation. So that you give in a very structured manner that you are going on. Yeah? You can make those little notes on your on the piece of paper which the examiner will give you, so that you are able to read it out from over there. Okay.
Okay.
Yes, Doc.
Yeah, I think the tips are, by this time you are already aware of what all are the tips that are there. Just make sure that you give it, you give your handover in 8 minutes. You just have to be aware of making sure that you complete it in time. And please keep it very, very simple. So no one is really asking you to give a very like complicated sentences or very big sentences or that sort of thing. And don't spend too much time into writing. As I said, that the written part is only for your purpose. The examiner are not going to be checking. You can just, as long as you are able to read what you have written, it should be fine. Yeah, no one else is reading that one. Okay, so don't spend too much time on making it a very neat writing and all that sort of thing. You have got only 8 minutes, so make sure that you are not taking more than 3.5 minutes in the written sort of the part, so that you have enough time to give your handover.
Okay.
And that is all about evaluation.